Hi, everyone. So today we're going to be talking about kidney stones. So to start, the chief complaint is, I'm experiencing a sharp pain in my right side and lower back below my ribs. It also burns when I am urinating. The subjective. A 40-year-old woman comes into the office complaining about a sharp pain on her right side and lower back. She is with her husband and says she has been experiencing the pain for over 24 hours. The pain usually comes in waves and lasts for 20 minutes to an hour. She also has an increased urge to pee, but is unable to due to excruciating pain. She also feels nauseous, has chills, and is on the verge of vomiting. On a scale of 1 to 10, she rates her pain a 9 and says she has never felt so much pain. She explains how the pain has stayed in one place, and she uses a heating pad to relieve the pain. The patient does not have a medical history and is currently not taking any medications. So, patient history. Her medical history, there is none. She is currently not taking any medications due to an illness. Social history, patient lives with her husband and 2 daughters. And her family history, the patient's mother had breast cancer in the early 2000s but recovered. And the patient's father is currently battling diabetes and dementia. So my discussion question today is, after reading the subjective, which part of the report is the best indication of kidney stones? A, the patient's pain in her right side and lower back. B, the patient's pain lasting longer than 24 hours. C, the patient's pain being a 9 out of 10. Or D, the patient's pain staying in one place and not moving. So the answer is A, the patient's pain in her right side and lower back. And this is a really big indication of kidney stones because a lot of individuals who do have kidney stones will have this pain and they often ignore it. They think that they're just having lower back pain, but actually the kidneys are in the posterior part of your body, and you think that you're having back pain when it's actually your kidneys, and then you start experiencing excruciating pain in your ureter, and then you're like, I have kidney stones. So the definition of kidney stones is that they are known as small, hard deposits of minerals that clump together and pass painfully through the ureter and bladder. They're also referred to as nephrolithiasis, urinary stones, and renal calculus. Prefix-suffix associations: nephro, the prefix, refers to kidneys. Lith refers to stone or rock, and suffix iasis refers to abnormal condition. So here's a further description of kidney stones. As you can see, there's these three terms that it's also referred to as: nephrolithiasis, urolithiasis, and renal calculi. And it includes the kidneys, the ureters, the bladder, the urethra, which is where your urine comes out of. And kidney stones appear when solutes in the urine precipitate and crystallize. And depending on which solute precipitates, that depends on which stone is created. So there's calcium oxalate, calcium phosphate, uric acid, cysteine, and struvite. So kidney stone symptoms. Kidney stones are described as being the size of a grain of sand, while some can be as large as a pebble. As you can see on the image on the right, the ones on the left side of the image are a little bit larger, more the size of a pebble. And then there's a little bit broken fragments up on the top right, and those are more the size of a grain of sand. Pain begins when the kidney stone causes irritation or a blockage, and the stone usually passes without damage, but it's accompanied by excruciating pain. So symptoms that are often included in are severe pain on the either side of the lower back, pain near the stomach, blood in the urine, nausea, vomiting, fever, chills, a burning sensation while urinating, and urine that smells bad or cloudy. So here's a quick video that we are going to watch, and it's a little description of kidney stones.
Kidney stones are hard stone-like lumps that can form in your urine. They are common and occur twice as often in men as women. Let's look inside the body to see how the kidneys work. The kidneys are two bean-shaped organs located near the middle of your back. They work as a filter, removing waste products and excess fluid from the blood, and returning clean blood to the body. The waste products and excess fluid become urine. It travels through two narrow tubes called the ureters to the bladder and leaves the body through the urethra. If there is an imbalance in the waste chemicals in the urine, crystals can form, which may build up into stone-like lumps. These are known as kidney stones. This can happen for a number of reasons, including not drinking enough water, a diet high in protein, or health conditions such as kidney disease. If kidney stones are small, they usually leave the body when you pass urine. However, larger stones can get stuck in the kidneys or pass down the ureter, causing irritation and blocking the flow of urine.
All right, so that's all that we're going to watch today. We're going to go back to PowerPoint. So next are the physical examination findings. During a physical exam, the doctor will often take the patient's temperature, check the patient's weight, lightly press on the abdomen or back to identify fluid buildup or pain, which can be indicative of hypoactive bowel sounds, and check for enlarged lymph nodes in the groin. They'll also ask about medicine or medical conditions. They'll ask what medical conditions have you had in the past, and are there any conditions that would make you more susceptible to kidney stones? And these would include gout, frequent UTIs, urinary system abnormalities. They're also going to ask lifestyle questions like how much fluids do you drink? What fluids do you drink? Grapefruit juice is one of the fluids that can cause kidney stones, so that's always a question. How active are you? Does your job require you to be active, or are you always sitting? And then what type of foods do you eat? As the video showed, high protein diets can also lead to kidney stones. So the physical examination findings, after asking both lifestyle questions and medicine conditions, medical conditions, allow the doctor to determine if the patient has kidney stones and will continue to have them. Possible treatment. So there's non-surgical kidney stone removal, and this is known as lithotripsy. And this is when shock waves are, as you can see in this image, shock waves are being forced through the body. It breaks the stones up into smaller pieces, and then they're able to pass through the urine a little bit easier. You can also take ibuprofen or acetaminophen to relieve pain. Medication includes alpha blockers, which will help relax the muscles in the ureter or increase your fluid uptake. If you increase how much water you're drinking, it can also flush out the stones through the urinary tract. Surgical kidney stone removal, this includes percutaneous nephrolectomy. This is a procedure using a nephroscope to locate and remove kidney stones, and the doctor inserts the tool into the kidneys through a small cut made in the back. But larger kidney stones may require lasers to break them down to smaller pieces, and anesthesia is often used. Cystoscopy and ureteroscopy, those are another two surgical ways. Cystoscopy is when you use a cystoscope to look inside the urethra and the bladder, and then during a ureteroscopy, the doctor uses the ureteroscope to see detailed images of the ureters and kidneys, and then once the stone is found, it can be removed or broken up. So imaging tests for kidney stones, you can either do a CT scan or an ultrasound. The image to the right is an ultrasound, but to start CT scans, it's a series of X-ray images taken at different angles using a computer, and it produces cross-sectional images of the bones, blood vessels, and tissues, soft tissues in the body. Ultrasound is an imaging method using sound waves to produce images of structures within the body, and ultrasounds are often used to detect cysts, tumors, obstructions, or infections within or surrounding the kidneys. So this can be used to indicate kidney stones. Kidney stone treatment, this includes for small stones with minimal symptoms. Medical therapy is used to pass the kidney stones, and this can be through medications like alpha blockers, which relax the muscles in the ureter and help pass the kidney stone more quickly. But if the stones are larger and need to be broken up, scopes can be used to remove the stones, and this can be through shockwave, lithotripsy, nephrolectomy, ureteroscopy, and parathyroid gland surgery. And multiple treatments exist, but it really just depends on the size of the stone and the cause of the stone, and they'll all function to break the stone down so that they can pass through the urinary tract, but it really just depends. So as you can see in the image, kidney stones that are too big to pass through, ultrasound waves crush the stones, smaller pieces passed out of the urine. And here are my references. Thank you.